Hi, this is Sherry Kimball, and this is case study number 1 for Nursing 602, and it is related to a patient with anxiety. This was a 27-year-old female. She's white, Caucasian, as a follow-up visit for anxiety. She was here, like I said, for a follow-up on anxiety and depression. She has a history of depression. The patient has been taking citalopram 20 milligrams daily, and she's compliant with the medication. She denies any significant side effects other than some daytime fatigue, and she's been taking the medication at night, which seems to help with that daytime fatigue. Overall, she's feeling better gradually over the past 2 weeks since she's been taking the medication. She continues to have some mild difficulty occasionally with sleeping. She does feel like her moods are better and her concentration and motivation are improved. She is certainly not suicidal, and she's pleased with the results of the medication. She is a single mom who's working and also going to school, and she seems to be managing things fairly well. She does have good family support, and physically, she feels fine. She's feeling better and really has no physical complaints other than her anxiety. This is the old parts review. So, on and off, she's had symptoms of anxiety and depression over the last 10 years. She's had increasing sadness, stress, anxiety just really in the last month. She says today that she's feeling better, that her mood and sleep and energy are better. She does still, like I said, have occasional times that she can't sleep. She still has some stress, but she says she's more motivated now. She still sometimes gets jittery. Her stomach aches are less, and she does have a better appetite, and she is sleeping more, even though there's times that she wakes up or she can't go to sleep. She's a single mom and also going to school, and just the daily stressors of all those things kind of aggravate her anxiety. Nothing really relieves it, she said, except the medication now is helping. And the meds are really what's helped her. She also is said she is thinking about maybe going to therapy, and as far as the severity, it was getting bad in August when she came in, but now she said she's feeling better. She does have a history of her mom having depression and anxiety, and then there's really no other family health problems to be aware of or concerned with. Like I said before, she's a single mom. She's taken college classes that are actually in Denver. A lot of them are online, but it sounds like she does go up to Denver. She's a non-smoker. She lives in an apartment with her 4-year-old daughter, and like I said before, has good family support. Doesn't sound like a whole lot of friends because she's so busy with everything, but she likes her job and she likes school. And a year ago, she had bronchitis. Other than that, she has a history of migraine headaches, which she hasn't had for quite a while. She's never had surgery. She is allergic to sulfa. She's up to date on her immunizations. She refuses to get the influenza vaccine each year, and again this year she doesn't want it. Her last tetanus was 8 years ago, and she does know that if she steps on a nail or gets a cut, outside, that she'll probably need to get another tetanus, and if not, when at 10 years, that she probably should get one. Like I said before, she's on citalopram 20 milligrams, takes one tablet daily at night, and she also has a prescription for Ativan, 0.5 milligrams, that she can take when she's real nervous or anxious, I guess. At night, she'll take one. She also, the way the prescription's written, so that she can take one tablet up to 4 times a day, or 3 times a day. She doesn't take the Ativan very often. She said occasionally at night, if she's had a bad day and she's just feeling stressed, like she might not be able to go to sleep, she takes that. She also has a prescription for the Imitrex for her migraine headaches. But like I said, she hasn't taken that, hasn't had a migraine for quite a while. And sounds like to me knows about taking the Ativan and not overdoing it, and also the Imitrex, when to take it. recognizing those, so seems to do well with her medications. Like I said before, she's generally very healthy. She hasn't had a change in weight. She's eating and sleeping better. That was kind of becoming a problem earlier in August, but not so much now. Still has some nighttime anxiousness. No rashes or abnormal bruising or any skin things that she's worried about or has noted. Denies any headaches or history of head injuries or seizures. She said that she sees good, doesn't get her eyes checked very often because she has good vision. She's never had a problem with that. Knows what her headaches are like versus like headaches from vision problems. No problems with her ears in the past. No stuffiness, nosebleeds, or any problems with her nose. No problems with her mouth. No swallowing, hoarseness, changes in taste, history of tonsillitis. Neck is fine, good range of motion, no tenderness, soreness that she's noted. Said there's no problems with her breasts, no discharge, lumps, bumps, anything like that. She does not do regular breast exams. We did talk about that. No history of wheezing, allergies, pneumonia, bronchitis. She did have bronchitis a year ago, but that was really the only respiratory issue that she can think of or problem that she had. She got over that and hasn't had any problems since then. No high blood pressure, shortness of breath, any abnormal heartbeats. Her stomach was bothering her some a month ago, but she said now it's better. Her appetite's better. No stomach pains, nausea, vomiting. Her bowels are good. No constipation or diarrhea. No burning, urination, or frequency with urination. No problems with her genitalia. She said no itches, rashes, or pain. Her menstrual cycle is regular and normal. She said for her, no broken bones, no problems with range of motion with any of her joints or extremities, no coordination problems, no neurologic problems, no seizures, concussions, and endocrine is fine too. None of the abnormalities with thirst, hunger, frequent urination, abnormal sweating or cold. So this lady is basically in no acute distress. She did look very clean, well dressed, hydrated, answered appropriately. You can see her vital signs here, which are all within a normal range. Skin assessments, good skin turgor, no bruises, warm to touch. Her head was normocephalic, no pain on palpation. Cranial nerves 2 through 12 were intact. Eyes, good focus, good pupil reaction, no drainage. Ears, tympanic membranes look normal. Normal nose, pink moist mucosa, no abnormalities noted there. Tonsils look good, pharynx, good gag reflex. Neck is supple, like I said before, good range of motion that she actually did for me. No masses, no swollen lymph nodes. Swallowing fine. Back, she has good curvature of her back, good range of motion, can move around. Lung sounds good, all lobes, no wheezes or rails, no cough. Heart rate sounds good, regular rate and rhythm, no murmurs. Soft, flat abdomen, non-tender, active bowel sounds, liver, spleen, good percussion there. She has full range of motion to all of her extremities, no swelling or tenderness. Alert and oriented ×3. Like I said before, cranial nerves are all intact, good reflexes, negative Romberg. No alterations in sensation, perception, anything like that. Her breasts were symmetrical, no retractions, discharge lesions. I did not do an external genital exam just because she was here for, mental health issues, not necessarily physical issues, and she indicated no concern or abnormalities, so that was deferred. No lab values, no lab tests were done today. She did have labs done like a month ago or 2 weeks ago when she came in to rule out any other medical disorders, the CBC, thyroid, UA, but none were necessary to be ordered today. I did do the PHQ-9 and the GAD-7 just kind of for my own practice. I think we ask those questions typically, but maybe don't always use the scale. And she looked back. I don't know that those had been done, but I just had her say, okay, 2 weeks ago, where would you have been? We did the numbers, and then today, where would you have been? So she was 19 on the PHQ-9 2 weeks ago, approximately, and 3 today. GAD-7, 18, and then 3 today. So you can see the significant improvement there from where she was. She still has a little bit of occasional anxious worrying, but not like before. Differential diagnosis, again, previously, all the medical causes for her symptoms were ruled out. So no high blood pressure, no angina, related to the anxious jitteriness, no asthma, anemia for feeling, or lack of energy or motivation, the hyper and hypothyroidism, the lab values there that could have been either making her anxious or making her fatigued and low energy. Ruled out any chemical causes, drugs or medications she's on. Also differentiating between the different mental health disorders to make sure it's anxiety and not like a bipolar or an eating disorder, because she talked about not feeling like eating, not having an appetite, and also not caused from substance abuse. So her final diagnosis or continued diagnosis is anxiety. Pathophysiology, we all know that normal physiologic reaction to stress is that fight or flight reaction. So the body's way of coping in a stress event or a threatened event to increase blood flow to like large muscle groups so that we can run away and breathe and our heart keeps working, slowing down the digestive system. These are all a response from cortisol and also which is mediated through the hypothalamus pituitary adrenal complex there, that's basically a negative feedback mechanism to meet the body's demands. So that's kind of normal stress. That happens in all of us, goes up kind of to respond and then comes back down. So she's probably having that with her stress, normal response, but also people with a history or a problem with depression or anxiety specifically have changes in their dopamine, serotonin, and the GABA. There's actually lower levels of serotonin, which is what makes us feel good, and lower availability of that gamma aminobutyric acid. And those actually decrease the dopamine then in our bodies. There's also an increase of norepinephrine, which creates that kind of jittery, heightened arousal feeling. Also with anxiety and depression, there's a familial link, and because her mom has anxiety and depression, that makes sense that she may have a little bit of family history or genetics that create that heightened sensitivity in her body. And also then environmental and social factors. She is a prime, single mom with a child, going to school, working, lots of potential stressors there that could kind of build up, and then coping factors come into that, how you deal with that which really isn't a pathophysiologic but a learned and environmental type response. The U.S. Preventative Services Task Force recommendations are listed here. We didn't do anything today because none of them were needed, but I listed here what they've been done. The cervical cancer screen, HPV, blood pressure is normal, alcohol screen was done 2 weeks ago, and also now, just as far as cause and symptoms, but also coping. All the genital type screenings, she had all those done, I think, when she had her baby, her little girl 4 years ago or around that time, and she's not sexually active now, so she's not at high risk. I did do the depression screen with her. Again, she's really not showing depression, more so just kind of anxious and an anxious time period in her life. We did talk about the effects of stress, what causes stress, and the effects on your body and muscles, and why, her stomach hurts or she can't sleep related to stress. Encouraged relaxation, what makes you relax or helps you kind of tune out the stresses. And also encouraged exercise, because that's help to relieve stress. And then talked about sleep hygiene, so avoiding caffeine and stimulants and even food close to bedtime, and all kind of electronics and light, extra light and sensitivity that would keep you awake thinking about things. And also the circadian cycle. My preceptor is really stressed the TV and phone and things like that, the lights on those throw off your circadian cycle for sleep. And then encourage good eating habits. If you eat good fruits and vegetables, proteins, limit your sugar, caffeine, and stimulants, that's just going to make your whole body feel better. And so that your body feels better, it helps you cope with stress also. So the plan is to continue on the citalopram and her lorazepam PRN as directed. She seems to be managing those well, and they seem to be working good for her. She is considering therapy. She has the hotline number to call at her school. She talked about that, and I think she's even done that for emergency situations and also just ongoing mental health counseling. I think there's a therapist through them that she could see and also talk to. She also has local resources that she can call for immediate or long-term support, and like I said, has good family support. She is to follow up in 1 month just to make sure the meds are still working for her and she's doing good. She does know that if things get worse, any kind of symptoms, that she needs to call or come in right away, and or call with any questions, changes if she develops side effects or just abnormalities in the ways that she's feeling now that might be from the medication. And these are the references that I used. Thank you.